All right, good day everyone. Today, we are excited to bring you our third community-led webinar sessions, IOL 201 Community Connect, current state of interoperability in selected sites in Luzon and Mindanao.
We have a esteemed panel. In our previous webinars, we've been covering DOH and PhilHealth collaboration behind the National Health Data Repository. So now we're going to look at the other end of the bridge of interoperability, the situation on the ground, to detect patterns across these different sites, and also now think about shared solutions that they can do together, and also propose to the Department of Health and PhilHealth if they need resources.
First of all, the South Cotabato has more than 1 million projected population, and we have a total of 199 barangays po dito sa South Cotabato. In terms of our health facilities, we have around more than 200 plus barangay health station. We have a product that we developed. We identified 2 referral pathways. We have created our own technical working group on UHC ICT. So what are our existing use cases? We have our South Cotabato One Health Information System. It's a locally developed in-house EMR with more than 100 modules that we identified that there are a lot of programs that should be digitalized. We have our digitized referral manual. We are, as mentioned, that we are also locally, first local government to be a system provider for Consulta, currently redesigning our system to be fire ready. We experienced that there are a lot of programs that do not talk to each other, create more fragmentation than connection. We need the DICT to step up. There should be a proper capacity building, particularly as we go about on the interoperability and wish list. So we wanted to have this full interoperability via HL7 Fire, and of course the unified dashboard. So what we are building is a data collection system, but we do not talk about how do we use our data.
Going to Zamboanga City Medical Center, it is designated as the apex hospital, not just Western Mindanao, but also nearby Barm Islands. With a catchment population of over 5.7 million, we actively collaborate with several hospitals and networks of healthcare facilities in the region. For HCPMs to function effectively, 3 key elements must be linked: referrals, health data, exchange, and governance. Our digital health strategy aligns with some of the elements of the Open HIE model. We've initiated the integration with PSA for digital identity verification. Also, we are able to develop an institutional human resource information system that will be the basis for our health worker registry, and began mapping standards terminology sets for products, supplies, medicines, and clinical inventory. Process mapping and fire mapping are ongoing to ensure future compatibility and structured data exchange across all services. One of the interoperability use case for Zamboanga City Medical Center is the Regional Telemedicine Center. This connects GCMC with over 60 rural health units and 25 hospitals and 18 correctional facilities, including hard-to-reach areas in the Barm Island provinces. This flow is envisioned to be bidirectional. So specific pain points include the lack of structured referral feedback, fragmented data policies, absence of regional digital health officer and team, and no shared clinical data repository. We plan to establish a regional clinical data repository aimed to institutionalize a FAR-enabled referral and navigation system. We propose appointing a regional health IT lead and team to oversee digital governance, FAR adoption, and capacity building across the network. And lastly, we call for sustained investment in ICT infrastructure, from connectivity and data centers to cybersecurity and system development through national budgets and partner support.
The Iligan City has declared itself interested to be part of the Universal Healthcare Implementation Scheme. So it became a UHC implementing site as of late 2023 and has envisioned itself as a smart city since 2022. But we only have about 20 doctors in the entire city health office in charge of the city's public health system. So imagine the distance we have to cross and the amount of patients that we have to see. Iligan City has tried to envision itself as a smart city. So we try to envision the future of interoperability, not only in healthcare, but also as we connect healthcare to social services, to other registries, so on and so forth. We always kept the idea of access in mind. We wanted an interconnected navigation throughout all of the LGU services. It's very important for us to start talking about telemedicine, appointment system. The digital transformation of the City Health Office and Iligan's LGU demands a fundamental cultural shift. So it's meaningful data collection, meaningful data analysis, and meaningful data visualization. We're also trying to make starting to create applications that would digitize our current registries. So we want to map out these individuals as much as possible. Electronic medical records, even though transformative, are useless if the workflows of our healthcare workers are ultimately disturbed. So we're also trying to create our eSCED or our eSCED system, or a consulta and appointment system, which is still currently in development. So as we develop this, we already have FHIR and interoperability at hand. We're also trying to create our own e-referral system. So the goal really is to create an interoperable web-based referral system to coordinate and streamline these referrals. We still have a lot to learn about the FHIR standard. There's still a huge learning curve to cross. Great, there's an HAE architecture at the national level, but it would have been a lot easier for us if DOH already gave us a model of how to do this at the local level, especially at the city level. There is still siloed national level reporting and databases. Basically, we have the same wish list. We want as much as possible FHIR standard certification trainings for all of our developers. We'd love to establish a SILab in Iligan City. We're creating our own e-referral system. Cotabato has its own e-referral system. I think Zamboanga has its own e-referral system as well. It would be much better for us to basically socialize and to share the software with each other and share our human resources and expertise with each other at no cost if possible.
So Baguio General Hospital and Medical Center, it's actually a huge hospital. It is a general hospital with multi-specialty capability. Even though we would like to expand our services, the manpower is usually limited. BGHMC actually is the end referral hospital of the Cordillera, and more than 40 to 50% coming from Region 1, Region 2, and even as far as Region 3. The red and the blue circles are actually the district health centers or the rural health units, and the blue ones, it means that they are capable for digital technology. They have good Wi-Fi, they have infrastructure for possible interoperability. Actually, in Baguio City, they are towards that goal of making it a smart city. We have utilized an emergency severity index triaging tool incorporated in the system, where we can already triage, or even those referring to us can already triage the people that they will be referring to us. During our capacity assessment in terms of digital technology, telemedicine, and ORS, we saw that there are really limited areas which has the capacity to interconnect with us because of the very low Wi-Fi access, a mountainous area in the Cordillera. This is actually the summary or the status of our telemedicine capacity assessment. It's a universal problem. Interoperability of system is really not yet established in our area. We need to really redesign maybe some of our homegrown system so that we can operationalize the back referral. Actually, we really want to feel actually the assistance, more of the strengthened collaboration of our mother agency, DOH Kimit Siguro, who would help us in the ICT infrastructure development. So we know that this digital technology is really one of the best solutions that we can have for us to reach the far-flung areas in our region, so that we can really provide quality services to them.
By sharing your time and your perspective from the ground, I think we are closer today than yesterday to interoperability.
2, 1, smile! Let's keep pushing the boundaries of digital health together. Thank you. See you. Bye.